As if the H1N1 pandemic wasn't already problematic for the United States, the epidemic of overwhelmed hospitals seems in danger of taking over. For several weeks, the amount of children affected by the flu virus has forced hospital administrators to open new rooms and temporarily renovate others to handle the overflow.
The current H1N1 pandemic is unique in that there is no ground zero, no city or state where it is most likely to make landfall, and no discrete beginning or end. It will not destroy buildings, but its effects will be widespread, prolonged, and have the potential to disrupt the normal functioning of communities.
The fear is that hospitals may be too busy to carry out their normal services for the public, and that the quality of care may also be compromised. Some hospitals across the country have been slammed by their regular capacity and flu sufferers turning emergency patient care into a 24-hour activity. Doctors and nurses feeling the strain who have rallied for healthcare reform have also turned their attention to the pandemic.
Common sense kind of things, washing of hands and avoiding traveling to areas where there are small outbreaks.
Doctors at the hardest hit hospitals say the number of patients needing urgent care and medical attention will rise, but the burden of patients could eventually force some hospitals to cancel services such as elective surgery.
We've already seen it pay off with places activating disaster procedures, setting up temporary facilities, including tents outside of their emergency rooms. And you know, while we first felt scared about that, that's exactly what's supposed to happen in an emergency.
The surge of infections led thousands of people across the U.S. to line up this week for vaccinations, which are in short supply. As of late last week, 16 million doses of H1N1 vaccine were available for shipping, far fewer than 40 million federal officials predicted would be available by now. Health officials have blamed the vaccine shortages on production delays. President Obama declared a national emergency over the weekend. Since then, Congress has been working with hospitals, allowing doctors and nurses to reinstate patients if they feel overwhelmed. The pandemic has now spread to 46 states, affecting millions of people. Last week, the epidemic of ailing children eased up, but doctors don't think their reprieve will last that long. They're waiting for parents to come down with the symptoms their children had. Colin Campbell, Washington.